So Harrison as a neighborhood is pretty small. It's about 3,000 people, around 1,200 households. We're snug in between South Minneapolis and North Minneapolis. We're the first neighborhood with north side addresses. Racially, we're very diverse. For the neighborhood association, it's really important for us to make sure that we are advocates for the residents that live here. We do that in a variety of ways, but one is to make sure that people are able to afford the neighborhood and stay in the neighborhood if at all possible. Through CURA and the maps that they've been able to assist us with, we've been able to identify folks that are fighting foreclosure or are having financial trouble staying in their homes. We're able to address their needs very quickly and help them with resources very quickly.
Community GIS at the Center for Urban and Regional Affairs is a technical assistance walk-in center providing data and mapping support for the Twin Cities nonprofit community. We operate within CURA, the Center for Urban and Regional Affairs, whose community engagement mission is to connect the resources of the university with the broader community for the benefit of all Minnesotans. The data that we use and collect for our projects come primarily from local administrative sources, city governments, county governments, the regional government, as well as state and federal sources of data. We use the data that we collect in a variety of ways. Primarily, we do mapping. So a group will request a housing condition property map or the conversion from owner-occupied to rental property. We will take this administrative data and produce reports that they can use.
We provide CURA with public data that the city collects in the process of doing our businesses. We have provided data on rental licensing, on code violations, on permits, and the number of permits that are being issued by the city. CURA has been on the cutting edge of data sharing and the idea of pairing public data with other data to get a better story, a more thorough and accurate story.
CURA and the CGIS program are able to do things with information that the Harrison Neighborhood Association doesn't necessarily have the expertise to do. If we're thinking about foreclosure data, it's confusing for us to know where to find that information if we were responsible for aggregating it. Being able to call up CURA and know that they have that information readily available, they know what to do with it, and they can get it back to us in a way that's readable and understandable. It's something that we wouldn't be able to do in a very quick time frame like they can.
Some of the project requests that we get require a deeper analysis. We will combine data sets from a variety of different sources or data from different departments within a city to produce something such as a housing market analysis, where we look at vacancies, property condition, as well as property value to provide a more complete picture of the housing strength in that neighborhood.
We use CURA a lot for help with digesting data, understanding data, especially data that we want to present back to the community. We use them as a sounding board for how to collect data, what data is needed. There's a trust that both of us, meaning the city, has gained for CURA because of its professionalism and the work that it delivers. CURA has also grown to trust the city a little more, and so that if we say, we're not quite comfortable sharing this data yet, they say okay, but they're also very comfortable in pushing us and challenging us to go ahead and provide more data.
A large portion of our work takes place within the City of Minneapolis, and so we've had a long and very strong relationship with various departments within the city that provide data. Some of them, again, informally, but others we have to establish relationships over time by forming contacts and relationships within departments such as the assessor's office or regulatory services, where we can go and make data requests.
CURA and the CGIS program definitely save the neighborhood association resources and staff time. Oftentimes, nonprofits have to research a grant that may fit what work that they want to do, but instead we are able to use the CURA program and have that work happen at a place that knows how to do it the best, but we can still benefit from that data and information.